You might have noticed that haziness over the Mid-South, so it might have been something you've seen. That comes from, like I said, from the Saharan dust that's been filtering across the Atlantic Ocean into the southeast. Our own Scott Mattis spoke with some health experts about some problems that could arise from this. Scott, what did you learn?
Well, good evening to you, Kid. Yeah, if you've been coughing, maybe you've had a tough time breathing over the last several days, it could be because of this Saharan dust that is blanketing Shelby County and much of the southeastern United States. That doctor I spoke with this afternoon from Methodist Le Bonheur says the people most at risk have COPD or possibly asthma, and in serious cases, this could result in death. High above downtown Memphis, it might be hard to see at midday, but millions and millions of tiny particles from the Sahara Desert in Africa have traveled thousands of miles to the Mid-South, causing concern for anyone breathing outside air. Dr. Dale Kreiner with Methodist Le Bonheur.
Essentially, that sub-Saharan air mass lifts up and brings particles and kind of blankets various areas of the earth. Now, what that means for us is we breathe in those particles.
A high-pressure system in the Atlantic Ocean this summer produced easterly winds blowing west from Africa across the Atlantic to the United States, leading to lower air quality and causing breathing problems for those with underlying conditions.
That causes inflammation, increased mucus production, and bronchospasm, which causes wheezing, which is really bad for people with pre-existing lung conditions.
Experts say even healthy people can experience shortness of breath because of the dust, especially if they're outside for long periods of time.
It can be a serious medical problem.
And while this Saharan dust event typically happens at least once a year, Dr. Kreiner says if the right precautions aren't taken for certain susceptible individuals, a reaction could be life-threatening.
If it triggers an asthma attack and that person is not able to seek medical care in a timely fashion, it can be deadly.
Okay, so that's the bad news. The good news is there is a system coming from the northwestern portion of the United States moving in a south-southeasterly direction, and that system will effectively blow all of this Saharan dust out of our area. But the bottom line to this big story is we should be wearing masks if you're affected by this, especially those N95 masks that so many of us were wearing during the peak of COVID-19. For now, live in Northeast Memphis, I'm Scott Mattis.